The carriers get a lot more money when you have Medicare, Medicaid, and hence this is why you see benefits such as paying your electric bill and things like that. Anyone who's watching daytime TV often sees, do you have Medicare and Medicaid? And why is it such a push for Medicare and Medicaid? Well, we talked about the $850 rough amount, and that can be vary based on star rating and also if you have certain health conditions. But also, if you have Medicaid involved in there, that $850 is more like $1,600 a month. So the carriers get a lot more money when you have Medicare, Medicaid, and hence this is why you see benefits such as paying your electric bill and things like that. The income limit is very, very low, and even just having Medicaid is not enough. Often for the best plans, you have to be what's called a QMB plus, qualified Medicaid beneficiary plus. Medicaid provides health coverage to millions of Americans, including eligible low-income individuals. Medicaid is administered by states and funded jointly by state and federal governments. Insurance carriers offer those with Medicare and Medicaid eligibility Medicare Advantage plans called dual special needs plans, or as we call them D-SNPs, with network options and extra benefits. These plans have governance over who can apply, when they can apply, and how often they can switch plans. In their way, it's a way of kind of making things easier because having Medicare and Medicaid can often be confusing, especially if you don't qualify for a D-SNP plan. You need to show them both cards. Well, as I said, presenting both cards places, if you forget, then you get a bill of the 20% of Medicare, or if a doctor doesn't take Medicaid, now you're looking at the 20% of Medicare. Now you can go to a doctor that accepts a network who maybe didn't accept Medicaid before. And in theory, although I always recommend you show both cards, your Medicaid card and your Medicare Advantage or your Medicare red, white, and blue card if you don't have an Advantage plan to all your doctors, it's supposed to be a lot more seamless.